rejection, tension, residue on a political basis. But another part of it is militia groups that have been in that region.
There's no predictions in this, but we haven't exceeded the 1,000 as of this morning, but we will likely exceed that today when we see the numbers later this evening.
Is the ADF the problem, and to what extent is it political tensions that's the problem?
As of today, we have received $34 million and have a current, urgent, critical financial gap of $54 million. That's despite having spent over $35 million of our contingency funds since the beginning of the year. We continue to do that in order to sustain the response, but that is not an inexhaustible fund, and at the current time we have reached critical levels in our contingency capacity to support the response.
Do you have one suggestion of what could be done on the political level to make your...
But fundamentally, we need the political forces, the political leaders in Congo to depoliticize this response and absolutely ensure that this response is not driving or being used to drive conflict. And I think that's what can be done. Now, that is a Congolese business. DR Congo is a sovereign country, and it needs to focus on solving its own problems. WHO is there to provide support to Congo in controlling Ebola as a member state of our organization. But equally, other international actors and countries can support Congo in dealing with the political, dealing with the security, and dealing with the financial and the operational challenges that we face.
To DR Congo. Hey. Okay. John, last question for you.
Yes, fine. Yes, Dr. Ryan.
Well, obviously the one we're using now is the RVSV EBOV vaccine, which is the Merck product, and the one we're looking at now is the J&J vaccine, which is the prime boost vaccine. And currently study protocols are being developed, and the necessary regulatory, ethical and operational planning is underway.
In Congo, compared especially to 2014-16, the nosocomial infections have been a big...
So we need the humanitarian space in which to do our job with our government partners, with the Ministry of Health, with the NGOs. And as I said, we call on all national and international actors to create the conditions in which we can do the job we have been asked to do, which is to stop Ebola. And yesterday was the first day where the daily number of people vaccinated has been the highest so far in the whole epidemic. So we've managed to recover from almost nobody being vaccinated for 3 to 4 days after Richard's death, to now having the operation back at a stage where we're vaccinating more people than we ever have before in the field.